afternoon to everyone here in Bulgaria and elsewhere in Europe, and good morning to our colleagues joining from the US. On behalf of the Nou-hau Center for Alternative Care for Children at the New Bulgarian University, I'm really happy to welcome you to this webinar. We really appreciate your interest in these vital topics that we are about to discuss today. A special thank you to our distinguished speakers, Claire Anderson and Alana Barr from Chapin Hall, for being with us. And another special thank you goes to the Tanya's Dream Fund, because without their support, this collaboration between the Nou-hau Center and Chapin Hall would not have been possible. This webinar is not just a standalone event. It is part of an initiative that we have just launched, and we will be dedicating ourselves over the coming year. Some of you may have already heard about this initiative, but what we are initiating actually is for the others, is a broad conversation aimed at lifting up our understanding and practice regarding the prevention of child-family separation. Everyone who is here today is welcome to join this initiative. And our plan for it is to clarify exactly what we mean when we talk about child-family separation and its prevention, just to make sure that we are all on the same page. We also want to explain why this topic is more crucial than ever in child welfare worldwide, and to explore what works in this field and, crucially, how we know it works. This last point is very much, as you can see, about data and measuring impact, areas that we as a research center are specifically invested in. So we intend to produce and disseminate various resources addressing these questions throughout the next year and through different kind of events and publications. So we consider today's webinar such a resource. We imagine that insights shared today could be of use of different stakeholders, from decision makers at the national level who define policies, to service providers and practitioners developing and implementing programs at the local level, and why not also parent activists advocating for better systems that put family support and well-being at the center of their work. So for more information on the initiative, you can follow our website and social media, or you can subscribe to our monthly newsletter if you haven't done that already. I really hope you enjoyed today's session, and please feel free to share the recording later with your colleagues who could not make it. Now, not that Chapin Hall needs a very big introduction, but I will hand the floor back to Eliza, who is facilitating today's webinar, to present them briefly. Thank you.
Thank you very much, Jenny. Before we go any further, I would just like to remind you that today's webinar will be approximately 2 hours. In the first part, our guests from Chapin Hall, Claire Anderson and Alana Barr, will give us their insights on reducing family involvement with child protection in the US. And in the second part, we will have a Q&A session whereby you can write your questions and we will do our best to answer them. Also, there will be a recording available on the website of the Nou-hau Center, as it was mentioned, and we will be very grateful if you could share it with your colleagues who won't be able to join us. Before we give the floor to Claire and Alana, we would just like to tell you a little bit more about them and about Chapin Hall. Chapin Hall started in 1860 as a nursery and half-orphan asylum in Chicago in the US. And for more than 100 years, it was a group home for the city's disadvantaged children. Over the years, though, it transformed its mission and earned a worldwide reputation for its pioneering strategies, for collecting, linking, and analyzing public agency data, and in order to understand and improve the effectiveness of programs and policies. Today, Chapin Hall is an independent, mission-driven policy research center dedicated to improving the well-being of children, youth, and families. It embodies an arc of divesting of institutional care and creating meaningful support for families instead. It partners with state agencies, governmental and non-governmental organizations to advance equitable systems, scale evidence-based solutions, and uplift community-led change. Claire Anderson is an American thought leader on economic and concrete supports as core to prevention of child welfare involvement and the development of a family and child well-being system that prioritizes family support and cross-sector partnerships. Claire is a senior policy fellow emeritus at Chapin Hol. She uses research, policy, and fiscal levers to improve outcomes for children, youth, and families. She engages child welfare agencies, stakeholders, and constituents in large-scale system change. Alana Barr is a policy analyst at Chapin Hol. She supports various projects, and her portfolio focuses on working with jurisdictions to implement the Family First Prevention Services Act and assist agencies in building their capacity to implement evidence-based programs. Prior to joining Chapin Hol, Alana served as a project manager with the United Nations Institute for Training and Research in Geneva, Switzerland, where she developed learning management solutions for diplomats and other international professionals. And over to you, Claire. The floor is yours.
Wonderful. Thank you so much, Litsa. We very much value being here with a Bulgarian audience today and internationally. And there are not many things that could bring me out of retirement, but the work that you all are doing and spearheading in Bulgaria is of international importance. As you noted, there is an ethos across the globe to keep families together and reduce family separation. And we hope to share with you a little bit today about our synthesis and translation of 40 years of science that helps us understand one mechanistic pathway to support families and to reduce family separation and reduce child abuse and neglect. So let's get started with our slides and begin a discussion about investing in prevention. And as Elitsa noted, we will try and focus a bit here on data and evidence. We will provide an overview of a number of studies, all of which require administrative data at the governmental level about what's happening with families so that we can understand whether or not our interventions and our supports are effective. So let's go to the next slide, and I'm just going to go backwards now in time, a lot more than 40 years, really that 100+ years that Elitsa noted. Chapin Hol really did begin as a half-orphan asylum and orphanage. Children were housed at Chapin Hol for long periods of time. And we bring this to the very beginning of our discussion in part to join with others around the globe who are looking for ways to transition out of orphanage care, institutional care, group home care, what we here in the US call congregate care, in the contemporary era, to something very different. Chapin Hol today is a research and evidence nonprofit NGO, and we have completely divested from institutional type care. And we are seeing NGOs in the US do the same. We have organizations that have been similarly situated for even longer than Chapin Hol was in investing in housing or fostering or otherwise caring for children outside of their home context, who are now focusing their resources and investments in family support or in research, similar to Chapin Hall. So on that note, let's go and look at some evidence about ways in which states, countries can begin to invest in families and reduce family separation. We will bring to you a very high-level overview today of 40 years of science in the US. And in sum, that evidence shows us that when families have reduced access to resources, economic and concrete supports, there is an increased risk of child maltreatment and family separation. Conversely, that science also shows us that when families have increased access to economic and concrete supports, there is a reduced risk of child maltreatment and involvement in child protection and family separation. That evidence here in the US is generally consistent across time and across types of studies with varying degrees of evidence. It is consistent across mechanisms, for example, cash, tax credits, housing supports, healthcare, parental family leave. And most importantly, that evidence is actionable. There is something that you and others can do with that evidence to align your actions with this evidence. As Elitsa indicated, we think there is something here for everyone, whether you are a governmental policy and decision maker, or you are a frontline caseworker responsible for child protection functions or family support functions. So we hope to give you a broad overview today and then to engage in dialogue with you about this evidence at the end of our presentation. So let's dive into that big overview, and this slide and the next slide operate as cascading from the last slide. So first, we're going to look at the overview of studies that we have showing that reduced access to economic and concrete supports increases risk for child protection and family separation. In the US, scholars across the country, researchers across the nation, have used administrative data regarding family separation to understand the relationship with a number of different kinds of economic policies and social policies. And we have learned that reduced access to social assistance benefits, a lack of childcare, lack of stable housing, income shocks or negative earning shocks, like a family loses a job or loses shifts on a job and their income is reduced. Reduced employment, they're laid off from their employment. Increased fuel prices and increased regressive taxes are all associated with an increase for child protection and family separation. So let's look at what happens on the flip side of that when we increase access or families have increased access to economic and concrete supports. There are really four general categories of supports where in the US we have studies showing a decrease involvement in child protection and family separation. Macroeconomic supports like unconditional cash transfers to families, tax credits, and employment. Concrete supports like healthcare, in this instance, our federalized healthcare insurance program for low-income families called Medicaid. Home visiting with nurses or other qualified and trained professionals that also include economic and concrete supports, childcare, pre-kindergarten care, housing care. Public benefits. So these are benefits or entitlement programs that are administered by federal or state governments. And these include how states spend on their benefit programs. There's wide variability here in the US, with some states spending much greater sums on public benefits to people who are impoverished, compared to states that spend very little or much less on families. And we can see the difference in family separation and child protection involvement. So other social assistance and food benefits. All of that happens, what we would say, upstream of our child protection system. And when you get directly into our child protection and family separation system, we also see that when you pair those interventions with economic and concrete supports, we see a decreased involvement in family separation. So let's go to the next slide and talk a little bit about just the pervasiveness of involvement with child protection, particularly in ethnic minority groups here in the United States. And we share this with you to help you understand the scale of our governmental involvement with children and families. In the US, over half of Black children, by the time they turn 18, have experienced an investigation from our child protective system. So that is an enormous involvement of our government agency walking into the living room of the family's life. If you take all children in the US, not just a particular ethnic minority, we see that nearly 40% of children in the US, in the 20 most, almost 40% of all children, and a little over 40% of children in 20 most populous counties in the United States, some of which are larger than Bulgaria, are involved with child protection. So in other words, or one way to read this involvement is that we are deploying the government's most intrusive intervention in the lives of families at a very large scale. And the overwhelming majority of these investigations do not result in a finding that the family had abused or neglected the child. So what we are seeing is a large degree of need in families that are triggering calls to our child protection system, but very few families being identified as having abused or neglected their children. And so what we end up with is this sort of back and forth around needs and who meets those needs and how are those needs met and how do we support families so that the needs are reduced. So in other countries, we imagine there might be similar scale of involvement with child welfare, our child protection or the child protection system, and a fair degree of need that is driving this level of involvement. Next slide. In the US, what we find that level of need or that level of intervention by the government is generally pointed at families who are poor. 83% of families investigated by child protection in the US have incomes below 200% of the federal poverty line. We think this is important to understand because we want to get to the root causes of this engagement and the root cause of child maltreatment and child removal from home. It is certainly not the only driver. But we think that it is a very important driver to pay a great deal of attention to. and to address as core to the set of solutions that are available to all of us. So what we think is happening, this poverty, this large intervention with families who are poor, we think that this might be what's happening. That families are becoming overloaded with material hardship. And this is increasing the risk for child maltreatment and involvement with child protection. These boxes that you see here are consistent with our empirical understanding of the predictors of involvement with child welfare. So these are not random words on a page. These are evidence-informed boxes: income loss, economic security, food insecurity, housing insecurity. And when all of those things, or even some constellation of those things, are on the bed of a family's truck, the truck doesn't operate as intended. Imagine this is a truck with a payload of 50,000 pounds. And if we put 100,000 pounds, or a family finds itself with 75,000 pounds on this truck, the truck just doesn't operate as intended. We've gone beyond the maximum capacity of a family, and different families have different capacities based on their resources, government support of them, their access to employment, their social status. There are a number of variables here for us to understand, but this is what we think is happening. We do find that material hardship is a consistent predictor of child protection contact. Unmet basic needs pose a remarkable and consistent risk for child protection over and above income poverty. This is one of my favorite slides from, I think, 2015. That helps us understand this from the perspective of a family who is receiving public government benefits, what we call here in the United States temporary assistance to needy families. So families that are receiving that benefit and are low income, if they experience at least one material hardship, we see that downstream of that hardship, there's a higher likelihood of an investigation for neglect and for physical abuse. If a family experiences multiple types of material hardship after experiencing no hardships, their risk of a physical abuse investigation goes up about 7 times. That is an enormous exponential bump in risk on the back end of that material hardship. And the other thing that this study tells us is that this is not just about neglect. So sometimes we make the cognitive error that if families don't have material resources or fiscal resources, that they are that the neglect might be the poverty. And we're just getting confused that the poverty is neglect. This study and many others that we have help us to understand that this is not just about what I'd call a generalized neglect. This also raises the risk, as we see here exponentially, for physical abuse of children. Next slide. And when we don't get ahead of this, it's very expensive. In the US, we have estimated the annualized costs of the economic burden over a lifetime. So that's a little confusing, but I'll explain it as best I can, and we can talk a little bit more later about costs. So one researcher here, Dr. Klicka, looked at data across states and at the national level, and looked specifically at 1 year of children who were investigated, 2018. and then modeled the economic costs that those children would experience over their lifetime based on reduced employment, reduced education, increased incarceration, lack of higher wages, and estimated that that 1 year cohort over their entire life course would generate about $3 trillion in economic burden in the US. So we often talk with decision makers or legislators, policymakers here in the US, and one of the things that they are most acutely aware of are the costs of our system. And how do we ensure that if we are resourcing families early, that there's a return on that investment? And here we see that indeed there would be. There are ways that we can off-ramp or reduce these economic burdens over the life course. Next slide. We also know that there is a negative return on investment for family separation. In the US, when children are placed in foster care and $1 is spent on that foster care, we have estimated, the researchers that you see here in the parentheticals, these researchers have estimated that there is a negative social return on that investment up to about $9.50. That's a very large negative return on that $1 spent. Next slide. And because we are a research organization, we love a theoretical model to help us ground our understanding of what's happening and what the set of potential solutions might be. This is the World Health Organization's Social Determinants of Health conceptual framework. And we understand the social determinants of health as drivers of child welfare system involvement. And the WHO, in creating this conceptual framework, said the following: the single most significant lesson of developing this conceptual framework is that interventions and policies to reduce health inequities must not limit themselves to the intermediate determinants. You see this blue box on the far right-hand side. The material circumstances, the biological and psychosocial factors that are inside of the family. We must also include policies specifically crafted to tackle the underlying structural determinants on the far left of this slide. How we govern, our macroeconomic policies, our social policies like our labor policies, housing and land policies, our public policies like education, health, and social protection, and our cultural and societal values. And I think in the US over the last 5 years, this has been among the most important insights that our conceptual framework in the US has always been based on the Elizabethan poor laws of the 1500s that really categorize people, generally speaking, into the good poor and the bad poor, who's worthy of receiving benefits and supports and who's not. And a belief that child maltreatment was solely a driver of characteristics of families. And what I think we are all coming to understand is that the decisions of families are very important, but the decisions that we make are also contributing factors to child protection and family separation. And that is a very difficult reflection to sit with, but one that is of utmost importance if we're going to find integrated solutions that address both the challenges that families are facing, like substance abuse and mental health, and also the challenges that we face in distribution of resources and our policymaking. Next slide. So let's look a little bit at some of the evidence-based resources and policy solutions that we see in looking at our data and the various ways in which governments and states can make choices that support families.
Yes, thank you, Claire. So just to highlight or to piggyback off of what Claire had said, in this next section, we really wanted to lift up some economic and concrete supports that have proven to be very effective at reducing the risk for a child maltreatment case and also family-child separation. And as I'm going through this section, I want you all to keep in mind your role as practitioners, researchers, data analysts, frontline staff, etc., how you in your role can take back some of this research and evidence to your team, maybe adapt it, adopt it, implement it, and really think about how you can utilize all of this information, all of this data as prevention strategies, again, for preventing child-family separation and preventing children and their families from coming to the attention of the child protection system or the child protection agency. So before I share some examples, I wanted to call your attention to this call from parents in the United States for humanitarian policies and strategies. Parents who are part of the Birth Parent National Network and the Casey Family Program's Birth Parent Advisory Committee really wanted to share their lived experience. So lived experience meaning that they have firsthand experience with the child protection system in the United States. Given their perspective, given their involvement with the child protection system, wanted to elevate to their community leaders, their policymakers, their decision makers, the need to transform child protection in the United States and the need to raise awareness about the need for increased prevention strategies and resources for families before serious problems occur and before those problems exacerbate to crisis situations. Wanted to highlight this as evidence that yes, the data is very necessary, but also the stories and the experiences of parents who have lived experience are also important aspects when thinking about creating solutions. So again, as you all in your roles as practitioners, data analysts, researchers, etc., think about solutions, let's not forget the parents, persons in the community who have lived experience. They also need to be a part of these solutions. When also thinking about families and parents, the family investment model really illustrates how economic and concrete supports positively impact child and family well-being. So as Claire mentioned earlier in her slides, families that receive sufficient and economic concrete supports, where families have resources to meet their basic needs, such as access to healthy and nutritious food, access to childcare, access to quality education, access to affordable housing, those families are more likely to invest in services and opportunities for their children, and the families are more likely to provide increased nurturing, responsive, and supportive parenting, which can ultimately lead to improved child and family well-being and lower their risk for child protection involvement. So I want you to keep this family investment model in mind as I'm sharing some examples of effective economic and concrete supports that we're seeing not only in the United States, but also within the context of Europe. So within the context of Europe, I really enjoyed doing some research on the European Child Guarantee, and I'll quickly go over the European Child Guarantee for those of you who might not be familiar with it. So the European Child Guarantee was a recommendation that was ultimately adopted by the European Commission in 2021 to ensure the protection and rights of all children and secure access to basic services for vulnerable children. Vulnerable children here means that those children might be experiencing poverty, homelessness, disability, migration. They might be of minority backgrounds, or they might have been placed in alternative care or institutional care. Some of the core guarantees that member states who are participating in the European Child Guarantee must ensure include access to early childhood education and care, access to primary and secondary education, healthcare, adequate nutrition, and decent housing. Wanted to just highlight here that all 5 of these core guarantees are examples that Claire had shared earlier in this presentation. And so it's nice to see that the research translates very well, not only in the context of the United States, but also in the context of what's happening in Europe and within the European Commission and the European Union. Specifically in Bulgaria, the European Child Guarantee, there was a pilot in Bulgaria. Bulgaria was selected as one of 7 member states of the European Union to participate in phase 3 of the European Child Guarantee called Participatory Action. This pilot really wanted to test the feasibility of ensuring that children in vulnerable circumstances have access to core services. And this pilot in Bulgaria specifically targeted children with disabilities, children in precarious family situations, and children with a minority racial or ethnic background, particularly Roma children. Some of the core services that were delivered as part of this pilot, specifically in Bulgaria, include home visiting care for families with young children, early childhood intervention services, inclusive high-quality preschool education, and preventive and family support services for children and families in precarious situations. Also wanted to highlight here that these core interventions, again, a lot of the research that we've been doing in the United States and a lot of what we advocate for here at Chapin Hall in our work and in working with states and jurisdictions focuses on what we call evidence-based practices and services. Each of these examples under the core interventions that were delivered as part of this pilot in Bulgaria fall under the categories of evidence-based practices and services. And so again, it's nice to see that regardless of environment, regardless of context, this research translates very, very well. So I personally appreciated seeing this as I was doing this research. So just to wrap up on the European Child Guarantee in Bulgaria, wanted to highlight a couple of facts and figures. So this pilot had supported over 13,000 children and more than 5,300 parents and built capacity among almost 800 professionals across the health, education, and social and child protection systems. Want to highlight that last piece about the different sectors. In order to create solutions, especially prevention solutions, it takes cross-sectoral collaboration and coordination. This prevention strategies and prevention solutions cannot happen in a silo. It takes many of us from different backgrounds, different sectors, different disciplines to come together with also persons in the community, persons with lived expertise, to come together and think about solutions and how best to prevent family-child separation, preventing child maltreatment, preventing children from coming to the attention of the child protection system. And so again, want to really highlight that last piece about that cross-sectoral coordination and collaboration. And then lastly, in terms of policy institutionalization, in 2022, the Bulgarian government adopted a national action plan for the European Child Guarantee implementation in Bulgaria. This really signaled long-term political commitment by the Bulgarian government. And under the National Action Plan, these measures are projected to cover over 200,000 children from vulnerable groups, specifically with the objective of reducing the number of children at risk of poverty or social exclusion by more than 196,000 children by 2030. So again, wanted to highlight these facts and figures, and I really do like this policy solution that has been implemented in Bulgaria, but also across the different EU member states. So moving to some examples of policy solutions that we've seen across the United States that have been effective at improving child welfare outcomes and reducing the likelihood of child maltreatment. The first one is unconditional cash payments. This researcher found that an additional $1,000 in unconditional cash payment to families in the early months of a child's life is estimated to reduce a number of child maltreatment-related outcomes, including reducing the likelihood of a referral for neglect by about 10%, reducing the likelihood of a referral for physical abuse by about 30%, reducing the likelihood of a substantiated referral by 15%, and reducing the likelihood of child mortality or a child death by 30%. So these are really, really significant findings and show that putting more cash in the hands of families, improving their income can ultimately reduce the likelihood of maltreatment-related outcomes. Another one, I know Claire mentioned this earlier, is the Earned Income Tax Credit. This is both a national and state level tax credit designed to help low and moderate income workers and their families. Across the United States, many states have been adopting the refundable state level Earned Income Tax Credit over the past 20 years or so. And these researchers found that a 10% increase in the generosity of the refundable state level Earned Income Tax Credit benefits is associated with a 5% decline in reported maltreatment rates and about a 9% decline in reported neglect rates. Additionally, the refundable state level Earned Income Tax Credit is associated with a 13% decrease in hospital admissions for abusive head trauma for children under the age of 2. So really think newborns and infants here. Another economic and concrete support that has proven effective is increased access to social assistance. In the United States, we have a lot of restrictions in terms of how families can access social assistance, particularly surrounding work requirements. So when states or jurisdictions ease social assistance restrictions, this is associated with fewer children with substantiated neglect and fewer children who have been removed from their family or placed into foster care. And an estimated 29,000 fewer children would have entered foster care nationally, so would have not been separated from their family if states had eased social assistance restrictions to increase access for families. Another effective economic and concrete support is access to high-quality childcare. We actually wrote a brief on this a few months ago, given the potential funding cuts to very important childcare and early childhood education programs. And I can drop the link to that brief in the chat if you'd like to learn more. But our research, or a lot of the research, finds that access to high-quality childcare helps prevent child maltreatment, helps reduce the likelihood of child protection involvement, and reduces the likelihood that a child enters foster care, reduces the likelihood that the child is removed from their family or separated from their family. Another one that Claire had mentioned is expanding access to health coverage for persons with low income and limited resources. So this study found that for states that had expanded access to healthcare coverage for persons with low income, this was associated with a decrease in the rate of screened-in neglect reports for children compared to those states that had not expanded this access to low income or to healthcare coverage for low-income persons. And had states expanded, there would have been 125,000 fewer screened-in neglect referrals for children under the age of 6 years old. So again, really underscoring the importance of providing access to a lot of these services, these policies, and preventing material hardship, especially for families of low income and that show the most need or are the most vulnerable. Another effective strategy or policy is providing supportive housing. This study found that children of child welfare involved families who face housing instability and who receive supportive housing or who are enrolled in a supportive housing program, such as receiving a housing voucher where they can participate in subsidized housing and receive case management, experience fewer removals, have a lower prevalence of substantiated maltreatment, and have increased reunification. Another big one in the United States is the food assistance programs. We have two primary food assistance programs. The first one is called SNAP, the Supplemental Nutrition Assistance Program, and the second one is WIC. It is a program specifically for women, infants, and children. We also wrote a brief on this one, and I can drop the link in the chat if you're interested in learning more about it. But in terms of food assistance programs, states that had more generous food benefits policies had experienced large reductions in child protection reports, fewer substantiated reports, particularly for neglect, and fewer foster care placements, again underscoring the importance of food assistance programs and their association with reducing the likelihood of child maltreatment. Another policy, another economic policy, is the minimum wage. Want to note here that the national minimum wage in the United States has remained stagnant over the past 16 years, and it has remained at $7.25. So this study found that from 2004 to 2013, states that had increased the minimum wage beyond the national $7.25 per hour had experienced a decline in child maltreatment reports, and that for every $1 increase beyond that $7.25 per hour was associated with almost a 10% decline in neglect reports, specifically among children who were less than 12 years old. Paid family leave is something that we also can improve on in the United States, and it's my understanding that Bulgaria has a very generous paid family leave policy. Maybe we can learn from you all and can understand more about your research, and would love to have a conversation with you all about the effectiveness and some of the research that you all have done around paid family leave. But in the United States, this study found that compared to states with no paid family leave policy, the implementation of California's 2004 paid family leave policy was associated with a decrease in hospital admissions for abusive head trauma among children who were less than a year old and less than 2 years old. So again, think newborns and infants. Just to wrap up here, family preservation, Claire had mentioned this before, but the provision of clothing, furniture, supplies, housing assistance, cash assistance, coupled with family preservation, these have shown to be very effective at reducing the likelihood of subsequent substantiated maltreatment and reducing the likelihood that a child is placed into foster care. In the United States, our National Academy of Sciences created a roadmap to reducing child poverty. They had simulated the effects of different anti-poverty policy packages using different economic policies that we have here in the United States. I mentioned the expansion of the earned income tax credit before. That's one of the economic policies that they had simulated. And you can see the others over here on the right-hand side. But the adoption of th's anti-poverty packages could reduce investigations by about 11 to 20% annually, particularly for Black and Latinx children and those living with single parents. So children who are of racial and ethnic minority and those living in a single parent household. And these economic packages could really substantially reduce racial disproportionality in the United States, which remains a pervasive issue. So in terms of spending, so states that had increased investment in public benefits programs by about 13% would have had reductions in several child maltreatment outcomes, and it would have further prevented child maltreatment. And so it goes to show and really highlight what Claire had said before, that investing in public benefits programs could save states and really the nation a lot of money, upwards of $153 billion due to reduced child maltreatment related costs. Cost, again, as Claire had mentioned, is something that is so very, very important when speaking with legislators, decision makers, policymakers. And so showing the evidence that investing in public benefits programs could save billions of dollars, I think that is such an important point to highlight. So just to wrap up this section here, wanted to share about two policy tools that the Chapin Hall team had created. This first one is on the association of economic and concrete supports to prevent child fatalities and abusive head trauma. In this policy tool, we outline how access to employment, access to housing, access to tax credits are all associated with preventing child fatalities and abusive head trauma. And I think it provides a lot of great evidence and a lot of resources that can be used to show that there is quite the link between economic and concrete supports and preventing child deaths and abusive head trauma, at least in the United States. And lastly, we also created another policy tool in partnership with one of our partner organizations, the American Public Human Services Association, outlining some state policy options, providing evidence, again, on these economic and social policies that have proven effective, where if you increase access to some of these economic and social policies, they can serve as a child welfare prevention strategy. And so when you have a chance, please do take a look at these policy analysis tools that we have created, and we would, again, love to talk more about it. Thank you. And I think back over to you, Clara.
Terrific. And just doing a quick time check. I think we have about 15, 20 minutes remaining for this part of the discussion. And so I'm going to transition a little bit to discussing data and evidence more generally. And the reason we want to do that is to sort of contextualize the kind of information that you need in order to understand whether or not interventions are working or not, or the degree to which they work, or for whom they might work more than others, as we've just shown you. So let's just go to the next slide. In the US, we have at least 2 national data sets that are worth noting here. Many others were tapped in order to look at how our public benefits work. But in order fundamentally to understand whether or not an intervention is reducing reports to child protection, investigations of families, and family separation, in the US, we use 2 specific data sets: the National Child Abuse and Neglect Data System, we call NCANS, and the Adoption and Foster Care Analysis and Reporting System, we call AFCARS. Researchers are also tapping the data administrative data sets of Medicaid, of temporary assistance to needy families, and they're also doing primary data collection. We understand and have been on a very long arc of one, encouraging the state and federal government to collect data systematically, to collect consistent data elements, and to make those data available publicly in a de-identified way, so that family names, children's names, any identifying information is removed from those data sets, but that the data are available for researchers, for states to be able to understand whether or not the choices that they make are having a positive or negative outcome, and for whom. At what degree are the positive impacts being seen or not? So let's go to the next slide. We've talked all hour about the effectiveness of interventions and the degree at which they seem to be effective in the context of the studies. And part of what researchers across the US, state government leaders, and policies are interested in is the scope and scale necessary to disrupt family separation. They want to know, is the investment and the intervention well targeted? Does it clearly address the core issue? Is it pointed in the right direction to the right population? Are the right partners included? Are the policy choices and investments appropriate to achieve outcomes? And the scope, is it appropriately sized, this investment? Are the resources and funding sufficient? Is the intensity of the intervention proportional to the need of the family, specifically and generally? And are we reaching enough of the right groups of people to achieve some degree of impact? Next slide. The goal, of course, is to be able to scale up an intervention like the European Child Guarantee in Bulgaria to reach more children and families while maintaining a degree of effectiveness. you want to understand whether or not there are enough success factors in play. Does the human service sector understand how much effort is required? Are they working in concert together, collaboratively in a sufficient way to achieve the outcomes? Is there data on scope, scale, and effectiveness being collected, reviewed, and disseminated? Is research and evaluation helping us to understand whether the intervention itself was implemented as intended? Because we often start looking for outcomes at the child and family level without ever understanding if we implemented that intervention well. We saw on an earlier slide the national plan for the European child guarantee in Bulgaria had 3 or 4 very specific interventions. Are those interventions being implemented as intended at the scale needed? And our cross-sector partners and lived experts coordinating efforts to exchange knowledge about what's working and not, to inform both short-term continuous quality improvement as well as long-term decision-making. And we wanted just to put this slide, this visual back in front of you as you're thinking about the implementation of the European Child Guarantee. We see here the desire to break the cycle of poverty and social exclusion across generations with very core areas of concern: social exclusion, effects of school performance and health, school dropping out, long-term unemployment, and poverty. Understanding where and how to point the intervention at what level for each of these areas, and to understand what happens is critical. And the only way to do that really is to have a collaborative relationship between the government entity that is collecting the data on child protection and family separation and those who are implementing the intervention, in this instance, the child guarantee, so that together that relationship can result in a more nuanced and rigorous understanding of what's working and what's not working, so that future decisions about the allocation of funding can be based on evidence. Next slide. In the US, we've tried to do that, and we've collected as much evidence as we've been able to. In fact, the evidence is coming at us so quickly, it is hard to keep up. But we've tried to synthesize and put into a visual, an infographic, the evidence that we have on hand to date and where and how that evidence makes a difference. So to summarize the evidence we've shared with you here today, we believe that families become overloaded with material hardship for a variety of reasons. And we see macroeconomic policies like minimum wage, paid family leave, tax credits, child credits, concrete supports like healthcare, childcare, home visiting with economic and concrete supports, direct cash transfers, public benefits like Medicaid and food plans, slowly but surely offloading some portion of this material hardship alongside families. And when those have not been sufficiently implemented or implemented at the scope and scale necessary to offload material hardship, and when families have other challenges at play and they become known to and investigated by child protection, that we provide evidence-based interventions that address those very specific challenges like substance abuse, mental health challenges, domestic violence in the household, and pair those alongside with additional economic and concrete supports so that family separation becomes a rare intervention and used when necessary to ensure that a child is not harmed. So what we wanted to do with this visual is to provide kind of an at-a-glance look at the evidence and provide a way for even lay people to describe ways in which families can be resourced that has a relationship with reduction of child maltreatment, child protection involvement, and family separation. So as Alana indicated, we have lots of tools and resources available for you. At this point, our bibliography is about 30 pages long, and we provide links to as many of the studies as we can. It's available on our website at this particular link. On the next slide, we have a QR code that you can use your phone to go to our main landing page that has all of our resources, including the policy analysis tool that Alana shared with you earlier, the 2 briefs that she noted, one on food security and one on childcare. We have others as well. We have tools for policymakers. We have tools for practitioners. The bibliography, we think, is a great resource, particularly if you have questions about any one particular study. You can go in and review the methodology, understand the effect size for those of you who are interested in research and evaluation at a granular level. And the Nou-hau Center also can be an enormous resource to you in its set of resources and its ability to further translate this body of science in the US to the Bulgarian context. So I encourage you to lean on the Nou-hau Center as well. And we are quite grateful to them for the partnership and allowing us to join you today. Thank you ever so much. And we're looking forward to any questions and dialogue you might have. And if you're shy today, or you think of something later that you are interested in pursuing, Alana's contact information is here and the best way to reach us.